So welcome back for another episode of an endodontist around the world. And today we are here. We have the privilege of being here in Japan and the honor of being received by Dr. Yoshi Terauchi. Dr. Yoshi Terauchi, thank you so much for receiving us after a long day of work. I know how busy you are, lecturing all over the world.
It's fine because I love my job, so I always enjoy doing what I like. So I never get tired. So I'm perfectly fine.
Oh, that's good to hear. And if you ever fractured a file or if you are afraid of fracturing a file, this video is for you. So stay with me until the end of the video that will show lots of things. And so, Dr. Terauchi, talk to me about your passion for endodontics and also what made you go in the direction of removing broken files so successfully?
Oh, it's a long story. First of all, if you want to be really good at what you're doing, you have to love what you are doing. Sure. So that's the key to success. So I never hated my job. Actually, I love what I'm doing. So then, you can be always better than you were yesterday. Yes. So I keep improving myself.
And you developed one of the most important kits for retrieving files. And so tell me about this kit.
Okay, actually I developed the technique to remove the broken instrument was in 1998 when I had a so difficult cases because in Japan, I don't know why there are so many cases with broken instrument. So every time I saw it, I had a headache.
It's very difficult to face that, isn't it?
Yeah. Of course, you can do the surgery, but I don't think the surgery is very predictable. And of course, you cannot be minimally invasive. Actually, you can be very aggressive because you have to root the root end.
Yes.
So it's not a good technique to remove the broken instrument by doing a surgery. So I kept thinking how to be minimally invasive in broken file removal. Then I came to this idea.
Yeah, and it's very conservative. Your kit is amazing. The lasso is phenomenal. So we can loosen the file. The problem is to bring that file out. So that I think is the biggest point, the most important point in the kit, isn't it?
Right.
And what makes our life, at least my life, it made my life a lot easier as an endodontist. And the eye motor as well. You've got you developed one of the best, in my opinion, motors with the apex locator. Is very precise, is very ergonomic and light and very comfortable. So I've got 4 of them in my practice. So how did you develop that? How did you come to that idea?
The idea actually came from my cases in my practice because 98% of my cases are retreatment. So I always see a ledge, broken instrument, and underfilling, and something like that. So every time I see a ledge, I have to think about how to bypass the ledge. But it was not easy. So I developed this idea because with this technique. So let me tell you how I use the T mode. This motion is called T mode.
Yes.
With the T mode, you can control 2 different motions. Usually, you need to start with a 90-degree watch winding motion because as long as you are using 90-degree watch winding, you will not fracture the instrument, you will not create a ledge. So I usually use a multisynthetic phase nickel titanium instrument, pre-curved. Yes. Then I direct the pre-curve towards the original canal. Then I will start 90-degree watch winding like this. Then with a small up and down motion. When you feel sticky, that means you are in the original canal. Yeah. Because when you feel sticky, as you
catching,
do,
isn't it?
Yeah, that's right. Then I click on the motors to change the first motion to the next motions, which is usually reciprocating motion. I use 380-degree clockwise and 50 degrees counterclockwise reciprocating motions at 150 RPM. This came out of my studies. I did so many studies on this. Then I came up with this reciprocating motions, 380 degrees clockwise, 50 degrees counterclockwise. with this motion, you will never fracture the instrument. You will never create a ledge. Yeah, very, very safe. But when I see crazy curvature, especially more than 60 degrees, I keep using the 90-degree watch winding because you can safely instrument the canal without fracturing the instrument. Because, if the instrument rotates more than 360 degrees, you may fracture the instrument if you push it too hard. But if you just rotate 90 degrees, you won't fracture the instrument. So if you go 90 degrees clockwise and another 90 degree counterclockwise, so with the watch winding motion, you will never fracture the instrument. The instrument will not be stressed. So I keep using the 90-degree watch winding until I pass the greatest curvature. Then I click on the motor. Then I want to use the reciprocating motion to be more efficient in instrumenting the original canal. Yeah. So this is how I bypass the ledge.
Bypassing the ledge is so difficult, isn't it? But it makes so much easier with the T-mode. I agree. It's amazing. If you haven't tried that, please do. And we'll probably put a link at the end of the video as well to show you how to do it. Can you just break the news for us, please?
Yeah. Actually, this is a new motor. This motor was developed to help you obturate the root canal with MTA. The new feature of 812, this motor is called 812MT. This has sonics. You can use sonics when obturating the root canal because with sonics, you can remove voids and you can further condense MTA. And when you instrument the root canal with a file, you can also use sonics because with the vibration of sonics, you can reduce torsional fatigue and also you can reduce the cyclic fatigue. And you can also touch all over the root canal walls with a small file. So it's really good. When I see the greatest curvature, like a crazy curvature, more than 60 degrees, I instrument the root canal with sonics. It will help you reduce the torsional fatigue.
That's amazing, isn't it? Yeah, very good. I want to try it. I haven't tried that yet, but I'll definitely try it.
Yeah. And everything is controlled with foot pedals. You can just push the pedal, then you can initiate the first motion. And it has a new feature. It has not T-mode, but T-mode plus.
Right.
With a T-mode plus, you can control 3 different motions.
Wow.
Yeah.
That's very good. What's the difference between the T-mode and T-mode plus? Is the 3 motions you said?
Yeah. T-mode, you can just control 2 motions. With a T-mode plus, you can control 3 different motions.
And that would be like the reciprocation, the continuous rotation, and the third one?
Third one is another clockwise rotation that you like. You can change the setting.
You can change the setting. That's
usually,
amazing.
When I use T-mode plus, I want to use it when obturating the root canal with MTA. Yeah. So this is T-mode plus.
Wow.
T-mode plus. Yeah.
Very good. Yeah. Amazing.
Watch winding, counterclockwise rotation, then clockwise rotations.
Wow, fantastic! I really want to try that. That would be amazing. Thank you so much.
Yeah, like this. The sonics. It works like endo activators.
Yeah, it does vibrate.
Yeah.
It's good.
Yeah, very good.
Fantastic.
And there are 3 different intensities: low, middle, and high.
Wow. And can you use that in like for disinfection as well?
Yeah, of course, because it will disrupt the biofilms.
Yes.
Yeah.
Fantastic. Yeah. So you have everything in one motor now.
Yeah.
Amazing. I want to try it.
The only shortcoming of this motor is a little bit heavy.
Right.
Yeah. That's all. Yeah.
But you've got everything in it. That's why, isn't it?
Yeah.
Thank you.
You know, I keep developing many things, including techniques.
Yes.
And for the broken file removal, I have been developing another technique.
That is probably coming.
Yeah, coming.
So I need to come back then to Japan.
Yeah.
When is it coming?
Very soon. Because I developed the files to remove the broken instrument.
All right.
Yeah.
Fantastic.
I developed these instruments with FKG. They are very good at developing the files.
Yeah, the XP Shaper was one that we would combine, isn't it? So now we're becoming like a new file system. I'm a fan of the XP Shaper and Finisher.
That's right.
So fantastic. That I'm looking forward to it now. The endodontists that or the general dentists that they want to pursue endodontics, what do you think it would be an advice for them to become a good endodontist?
Oh, good question. You became a dentist to save the tooth. You didn't become a dentist to extract the tooth and place an implant. But unfortunately, I have seen so many Japanese dentists, at least Japanese dentists, keeping extracting the tooth because they want to make money. They know they can save the tooth with endodontic treatment, but they don't want to do endodontic treatment because they want to make money. So they tell the patient, "Oh, this tooth is not good in a bad condition." So it's important to extract the tooth and place an implant. You need an implant.
And it's such a shame, isn't it? Because the implant is your last option.
Yes, that's right.
So you need to try to save your tooth or your patient's teeth as much as you can. Absolutely.
So I want to recommend have passion. Have passion. So people with passion change the world. Okay, because I'm very, very passionate.
I'm passionate as well.
Everybody, if you see a good endodontist, they are always passionate.
Because we can see out there that people are more concerned in technique. It's not only technique, it's all behind that. It's your knowledge as a general dentist as well. You are not only an endodontist, you have the whole combination and the passion for sure is what drives you to achieve your success.
And if you meet difficult cases, believe you can. You are halfway there.
Yes, exactly.
Yes.
And I think that's probably why you became so famous in your lectures and also in your academy. The Dental Art Academy is a success as well with lots of courses. So if you could tell us all about that, that would be amazing.
The reason why I opened my academy was I wanted to spread the techniques to other dentist colleagues. So I opened it in 2013. Then I started teaching my techniques and how to retrieve the tooth and everything, including broken file removal.
Oh, that's just fantastic, isn't it? So if you have the opportunity to come here for a course or anywhere in the world, because you lecture everywhere, isn't it? So go for it because the course is amazing.
This is my teaching facility, Dental Arts Academy. So I teach here almost every week or maybe sometimes when I'm busy traveling, I teach once a month. So it depends on the month.
Amazing. And you probably have people all over the world coming here.
That's right. So that's why I invite so many speakers here. So even I invite periodontists.
Oh, very good.
Yeah, because the endo and perio are always related.
They are. They are indeed. Which is still a little bit difficult for people to understand, isn't it? The endo-perio lesions or perio-endo lesions.
If you don't know how to fix the perio problem, so you are in trouble. So that's why endo and perio are very, very interesting to me because they excite me all the time.
I agree.
Yeah.
That's true. And I think most of the cases of failure with big lesions, when they think about single visit, multiple visit, perhaps they are not understanding why it's failing in the first place, isn't it?
That's right. That's right. You have to always think about how to disinfect the tooth.
Yeah, the disinfection is indeed the most important part of the treatment. If you do a wonderful mechanics and a wonderful obturation, but if you haven't disinfected it, then what's the point? It will get reinfected and it will fail. Shall we go downstairs and see the Dental Art Academy?
Okay. So we have everything actually. High speed, ultrasonics, and strobe.
Surgical courses as well, or?
Yeah, everything. Yeah, surgical courses, non-surgical, perio course, and also restorative course.
Wow.
Yeah, everything.
Very good. So start and finish without any problem, isn't it? Learning all the steps.
And we have a special program, 1-year program, that's called Toronto Study Program. Professor Shimon Friedman is the director of that program. He invites Steve Nimzig and Gilberto Debrian from Norway,
Yes.
and Anil Kishin, professor of University of Toronto. And
you lecture over there as well. You
yeah,
invited professor
that's
over
right.
there, aren't
That's
you?
right. That's right.
Yeah, fantastic. Yeah, it's wonderful.
Mhm.
Wonderful. The facility and the courses you offer is amazing. I would like to thank you, Dr. Terauchi. Thank you so much for taking the time, for being here with us. And I hope you have enjoyed that as well, as much as I did. So thank you.
Thank you very much. And I really enjoyed talking about this with you.
Thank you. Thank you very much. And if you stayed up to the end, so follow the link below and you can see the cases. And also drop a comment if you ever fractured a file, or if you are scared of fracturing a file, drop us a comment below so we can discuss it. And take the opportunity, there is a form as well for you to fill, just 2 minutes, just to give us an idea what the other topics you want me to talk about. And we'll go around the world to visit another wonderful and very successful endodontist. Thank you.
Thank you very much.